Welcome everyone to another wonderful episode here at Doctors of Podiatry. This is an absolutely gorgeous transformation. I'm really excited to present this case to the world. This patient presented with multiple chief complaints. We did a lot of work to to both feet here. This is basically, for all intents and purposes, this is sort of almost, if not what they coined the Cinderella procedure. Patient presented with bilateral bunion deformities, the patient was not happy with the appearance of the great toes, a lot of adipose fatty tissue on both sides, especially on the lateral aspect of the great toe. And I will explain, why we also had to address that. Morton's toe, the long toes, digits 2, number 3 on both feet. On number 4, the fourth toe was deviated, right? It was deviating laterally. It was not, in a straight position. So we also had to address that. We also had to address the tailors over here, okay? And also the tailors right here as well. So I want Caesar to come around here. Let's take a look first at both feet. So of course we're gonna definitely show, we'll integrate the before pictures, and I sort of drew out for all, for the world to see, when the patient came in. Of course, when we look at the parabola, these two toes, toe number 2 and toe number 3, were out to here, and you guys will see on the picture. Okay, the great toe was obviously it was hitting the second toe because of the bunion deformity. This patient has healed incredibly well, and when we talk about patients, every patient is different. We're all different in respect to how we heal. This patient, has healed exceptionally well, but this patient has also poured heart and soul into the post-procedural protocol, and this is where you see it the most. You can still see a little bit right in here, the little incision of where we did the toe tuck, right? The patient, all of this you couldn't see, right? The inner space here, this is all filled with fat from the great toe. So we had to do a little toe tuck, excise that to make the toe look really, really pretty like that. And that's why I placed this arrow here to obviously show you guys, we did that. So again, just to recap, we straightened the toe, bunion correction, toe shortening number 2, number 3. Nothing was done with toe number 4. Actually, I take that back. I think we definitely straightened it. There was a tiny little bit of a hammer mallet toe. We addressed that, and of course also the little tailor's deformity. On the left, same thing. You guys can, we at this point we can't even see, just because the patient, again, she was telling me that she has been really pampering both feet. There was a tiny little suture. I think you guys can actually see here and here. Same thing. It's so everything that we do is tiny little suture. But again, same thing here. Now you can actually see the inner space. You can see still the little incision there from the toe tuck. Bunionectomy. 3-stitch. 1, 2, 3 over here, and then again, I drew this for everyone to see. These toes were actually out to here. I want everyone to really look at the difference between, where this, imagine this toe was out to here, right? And this is the difference from here to here. When this toe was over here, it was like a centimeter and change. There's definitely a striking difference. And then, of course, the tailor's bunionette. And this toe was actually, moving that way, right? Completely. And you guys will see the pictures as well. This is just, when we talk about a beautiful, beautiful transformation, you know, this is the you know, this is a true definition of a real transformation. You know, it's only been 3 weeks. You know, this is sort of where I sort of like scratch my head. Sometimes, you know, everyone is different. And sometimes I sort of feel bad for, you know, the people that have really, really great, right, they're otherwise healthy, they you know, they don't smoke and they don't have any comorbidities, and then they take a little bit longer to heal. And again, that's where it takes us back to everyone is different. Mm-hmm. But I mean, when we talk about recovery, you know, it's critical. It's definitely critical. What you know, it is an investment. Whatever you put in is what you get out. Mm-hmm. I can continue to talk about this case, I mean, cases as such for a long time. You know, this case was performed in an office-based surgical suite under local anesthesia. The patient was awake. Patient walked in, patient walked out. Mm-hmm. The patient is from out of town. And, you know, I commend the patient for a lot of reasons. I really do. I couldn't be happier, and I think the patient
Thank you.
is extremely, I think, happy with where we're at 3 weeks. It's not like 3 months, you know, and there's barely any swelling, believe it or not. Yeah, the toes look a little bit swollen and but this is just like, you know, I'm congested. I'm just kidding. But I'm very happy. We will definitely do, you know, we'll see this patient probably, you know, maybe one more time in a couple of weeks, and then you guys will be able to really see the difference between today, right, at week 3, and then, you know, maybe in another 3 weeks. There's going to be a tremendous difference. But we will continue all the recommended therapies, you know.
Okay.
I'm sort of like speechless just because it's been such an incredible transformation with so many procedures that were done. But I've always said, you know, the easy part is what we do. The hard part is afterwards, right? The recovery. For all the non-subscribers, subscribe. Make sure that your notifications are definitely on. We will continue to upload educational videos as such. Really important, educate the world that minimally invasive foot and ankle surgery and minimally invasive anesthetic foot and ankle surgery does exist. We will continue to educate the world 1 foot and 1 toe at a time. As always, I appreciate everyone for watching. Have a wonderful day, everyone.